Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
EMDR therapy for PTSD, how clinicians decide it's the right fit. Choosing between effective PTSD treatment options can sometimes feel like trying to pick a path while standing in the fog. People hear about therapies that work. But the real question is whether a specific therapy fits your history, your nervous system, and what your life can realistically support right now. EMDR therapy for PTSD has earned a strong reputation because it can help target the parts of trauma that feel stuck. But it is not automatically the right answer for everyone. Today, we're going to walk through how clinicians actually decide whether EMDR is the right fit, step by step, so the decision feels less mysterious and more grounded. What is EMDR therapy? EMDR therapy is a structured trauma processing approach, but clinicians don't recommend it automatically for every patient with PTSD. Instead, they evaluate several things first. They look at symptom patterns, trauma history, nervous system regulation, functional stability, and the client's readiness for trauma processing. Screening tools like the PCL-5 and the PTSD-5 often help guide the process, along with functional measures and ongoing symptom tracking. When EMDR is matched to the right patient profile and delivered with proper stabilization and monitoring, research shows it can be highly effective. Step 1. Assessing PTSD symptoms. Clinicians usually begin with the basics. A PTSD diagnosis matters, but the shape of the symptoms matters just as much. In practice, many clinicians use validated screening tools to measure symptoms and track change over time. But the deeper assessment often focuses on specific patterns. For example, do intrusive memories appear as vivid sensory flashbacks? Do they interrupt attention during daily life, at work, while driving, or in relationships? Do avoidance behaviors dominate daily routines? When PTSD symptoms show up primarily as intrusive sensory memories that seem to refire repeatedly, clinicians may begin considering trauma processing therapies like EMDR. Step 2. Mapping the trauma history. After symptoms are assessed, clinicians look at the trauma history. This helps guide treatment planning. They evaluate how many traumatic events occurred, how organized the memories feel, and whether a clear starting point exists. Single-incident trauma can sometimes be easier to target in EMDR because there is a specific memory and trigger pattern. Complex or chronic trauma can still be treated with EMDR, but clinicians may spend more time preparing the nervous system first. And it helps to remember that trauma can look very different from one person to another. Large research reviews show that PTSD treatment studies include people with many different trauma experiences, from accidents to assault to combat exposure. This reminds clinicians that the cause of trauma doesn't automatically determine the best treatment. What matters more is the pattern of symptoms and the person's stability. Step 3. Assessing nervous system regulation. Before beginning trauma processing, clinicians carefully evaluate stability. This sometimes surprises patients who feel emotionally ready to dive in, but the body can tell a different story. Therapists often talk about something called the window of tolerance. This means a person can experience distress without becoming overwhelmed or shutting down completely. Function matters here too. Are coping skills working outside the therapy session? Is daily functioning stable enough? Clinicians often track symptom change using tools like the PCL-5 alongside measures of psychosocial functioning. Structured monitoring allows the therapist to determine whether the system is stable enough to begin, continue, or pause trauma processing. Step 4. Evaluating client readiness. Even when symptoms and history suggest EMDR could help, readiness remains a collaborative decision. Clinicians look for internal signals, not just words. For example, does the person genuinely want to process trauma, or are they mainly seeking symptom suppression? Can trust form between client and therapist? Is the person able to notice internal experiences without feeling overwhelmed by them? Sometimes clinicians slow things down if severe dissociation dominates sessions, or if active substance use or ongoing safety concerns create instability. Even within trauma-focused therapy, timing matters. Why clinicians choose EMDR? Once the assessment is complete, the decision becomes strategic. Clinicians don't choose a therapy because it's trendy. They choose it because the method matches the patient's symptoms. EMDR follows an 8-phase protocol and typically uses longer therapy sessions. It involves holding traumatic memories in mind while performing bilateral stimulation, such as guided eye movements. This dual attention process can help the brain gradually reprocess traumatic memories, reducing their emotional intensity. A clinician might recommend EMDR when talking through the trauma in detail feels too overwhelming. The main issue is the vivid sensory stuckness of a traumatic memory. Or the clinician believes dual attention processing will help the brain reorganize those memories more effectively. Research also shows that EMDR performs well alongside other first-line PTSD treatments. In some studies, EMDR and prolonged exposure therapy both produce significantly better outcomes than no treatment. Clinicians also watch closely for early improvement. In some patients, symptom reduction appears within the first 6 to 8 sessions. If no progress appears by that point, clinicians may reassess the treatment plan. Moving forward with clarity, choosing EMDR therapy for PTSD is never a generic recommendation. A thoughtful clinician looks carefully at symptom patterns, trauma history, nervous system stability, and readiness for trauma processing. Then they track progress using real measurement, not guesswork. That precision often makes the difference between feeling stuck in PTSD treatment and feeling like something finally begins to move. Thanks for listening to this episode. In our next episode, we'll explore another powerful mental health treatment and the science behind how it works. We'll look at how ketamine helps the brain create new thought pathways, why that matters for people living with depression, and how this process may help break long-standing patterns that traditional treatments sometimes struggle to reach. If you're curious about the neuroscience behind ketamine therapy, you won't want to miss it. Until next time, thanks for listening.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.